Recording. Great. So welcome everyone to our second peer review meeting for the Kaiser historical load templating project. Let me pull up. So we've got a couple things on our agenda today, and see if I have. Let me pull that up and try to share my screen. Yeah. Sorry about the delay here. Sharing. Yeah, so welcome to our second meeting. We've got a couple items that we wanted to go through. The first one is we're going to share out, we've just completed the first draft of our ASHRAE conference paper that's associated with this data collection set and review. And we wanted to walk you through the paper and just sort of give you the highlights from that. And one of the requests back to this group was Herb sent that file out, a PDF of the paper out yesterday, and our request will be for you guys to just take a look at it and offer peer review comments back on that paper as well. It'll be going through the same standard ASHRAE conference paper review process as well. So we'll be getting a broader set of responses there, and you may actually get asked to provide comments from ASHRAE and from us. So either one is fine. But we'd appreciate your feedback on that. We were going to be, I think the final draft of that back to ASHRAE is after the holidays. I think we're getting our ASHRAE comments back on like January 1st or 2nd in that time frame, and then we'll be incorporating those comments into the final version of that that'll go back to ASHRAE. And then the second chunk that we wanted to go through today is looking through the peer review comments. So I think we're going to switch the order here and do that first, or do the ASHRAE paper first, and then go through the peer review comments, because that'll be more of a conversation back and forth. We also sent out a compiled version of comments from everybody that's sortable by firm and sort of by topic. I don't know, I don't want to call it severity, but sort of impact, high, level, low. And so we'd like to just go through those and have a general conversation, and hoping you've had a chance to look at some of the comments that other firms have made, and we'll open it up and then be able to share generally the process that we've gone through so far. I'm not sure, I haven't talked to Herb yet, but we are also part of this project be issuing a sort of final report to Kaiser with a little bit more in-depth look at some of the data sets. The ASHRAE paper is pretty condensed, where we have a page limit, so we can't obviously include everything that we'd like to, but we may ask to have another meeting to review some of the more in-depth analysis that we're going to be sort of finishing up in the next couple of weeks. Any questions on the agenda before I hop over to the ASHRAE paper? Great. I'll stop sharing that and share the ASHRAE paper. Just a second. No. So as part of this project, as you guys know, we've been asked to, or we had submitted the opportunity to present at I think it's going to be in the summertime ASHRAE conference, submit a paper for that conference, specifically looking on healthcare loads. So we've sent you a draft, and it's definitely a draft, but it sort of outlines the process that we've gone through on the analytics side. it gives a little bit more background on the total data set that we have available to us that we're working from, and sort of walk through the intent of the research project, which a number of the questions in the peer review comments kind of came around what is the intent of the project. So we're certainly happy to share those or share that intent. And then we dive into a little bit more detail on the data set or the various facilities that we were able to pull data from to give an idea of where they are geographically located as well as climate zone, since a number of the peer review comments also sort of talked about how applicable or how are the lessons learned from the data that we were pulling, how applicable are they to different climate zones. And so we'll go ahead and listed the facility that we were able to pull data set from. We included both sort of the ASHRAE level climate zone as well as the California Energy Commission climate zone, which is a little bit more nuanced. One of the things that we've wanted to put in here because we thought it was relevant to get a general sense of the quality of the data set and the applicability is we've included the ASHRAE design day conditions pulled out of the latest standard, as well as at each of these sites where we are also able to trend outside air temperature. And so we wanted to actually include the 0.4% design day, if you will, that was actually measured on site, just so you could get a sense of where that value is relative to what somebody may have been using as a design condition. There's a little bit of content in here, just looking at how many actual data sets that we have and which points we were trending and which data sets we were pulling from the trend sets and where they go, and essentially what the aggregated data, what we started to look at. So this was essentially looking at sensible cooling loads. We included some sample tables that we are building out. This is an aggregated table, but we have tables that we've built out for pretty much every zone type, and we can break it out by orientation for certain facilities, et cetera. So quite a bit of content there. And then overall process that we started to use to look at diversity as well. I think one of the big things that we're trying to get out of the information is what are some more consistent block loads or diversified block loads for different room types, and how does that compare to sort of industry standard diversity factors that we might apply to a project. That data we haven't mapped out, or it's not included in the paper, but we have some charting that's still in process for looking at that block load size relative to the diversity factor. But we'll be able to share that with you guys as well for your feedback, since I think ultimately that's probably what's going to change the most or be one of the biggest factors coming out of the results. And here I think this wasn't available the last time we met, but we've started to put it, sort of take each of the room types that we have, and this is probably going to address a lot of your questions. So in this table, we're able to share out all the room types that we were able to pull data from, this total sample size, so how many zones we were able to pull of that room type, and then you can see how it breaks down between the different geographic locations, the different facilities, how many samples we were able to pull from San Leandro, Modesto, Riverside, and South Bay. And then we started putting in or calculating out the zone cooling loads for those spaces and starting to plot those out. Essentially, how many hours are cooling loads with certain percentile exceedance values, as well as sort of this sort of extreme case way out at that 0.4% condition. You'll definitely be able to see there's a number of zone types that are a little light. When we look at like med prep, we only had a total sample size of 6 and only 3 in 2 locations. And so we've put them in descending order, which could essentially align also with our confidence in the values that we're pulling based on that sample size. I think the intent is that data could be continued to be grabbed as more facilities come online and as we have more time to pull that BMS data. But you can get a sense of how many rooms we have from each space. I think one of the big questions that we've had throughout this process is what is a sample size that is appropriate for starting to learn things, and where is that cutoff point of where the sample size is just too small for us to glean anything useful. The next graph is looking at, again, the sort of diversified load. And you can start to see one of the things that we were trying to find out is, as design engineers, as we're sort of practicing and designing systems that support these room types, as we're going upstream and applying a diversity factor or looking at a block load, how close is that estimation to real life? And so you'll start to see for each of the room types, again, we're putting the total data set size there so you can see that and see how applicable you think or how valuable the data might be. And if you track all the way over, we're showing for that total room count what the max block load, the max simultaneous block load is for that space. At that time that we saw the max load, how many zones were actually in cooling, because we definitely see that not all the zones are even in cooling at that moment when the max block load is seen, and then we've put the time of day in there as well. At the far right, you can start to see when we actually calculate the block load that we saw at that peak hour, we calculate that against a design load, and you can get a sense on the far right of what sort of a diversity factor shows up at that time. So when we had, just an example, 27 patient rooms in 2020, at the hour where we saw the maximum block load, only 18 zones were in cooling, and the actual load that we saw relative to the design load was only 31% of what the peak, if we summed up the peaks for each of those rooms. So that data has started to get put into the table, and like I said, as we finish some of this work, we'll probably be able to add a little bit more nuance to some of that. We've started to put some of the conclusions in here, but they're very light right now. We're still working on what the big takeaways are. But as we go through this, we'd love to start to get some of the feedback from you guys. Before we jump over to look at the peer review comments, I was just curious if anybody had any just questions just as we are walking through this paper for the first time. And I can't actually see you because I'm sharing, so feel free to speak up.
Stat, this is Louise, TK1SC. So, can you hear me?
Yes, we can hear you.
Yeah, okay. Sorry if it cuts off. So when you mentioned the diversity based on the design load, remind me again how you were able to establish the design load. Was it correlated to the CFM in the room? And then what did you use as far as delta T?
Sure.
To establish that design.
Yeah. So I think for one of the facilities, I think at San Leandro, we actually have the design load from the design documentation that we were able to apply. But in the case of the calculation, essentially what we did is we actually, through the data set, looked at all the peak loads that ever occurred for that space type and took a 0.4% peak load out of that data set. And so that was what we used for the denominator for this sampling. But we also have the ability, at least in San Leandro, to see the actual design load from the design documents. So we can compare it against that as well for the individual zones. Yeah, and so the delta, in terms of delta T, we use the same for this 0.4% peak load, using that as the denominator. we use that as the same calculation method that we are for what the actual loads are that we're experiencing. So it's the supply air temperature coming off of the box relative to the room temperature.
So, Stet,
Thank you.
Yeah.
this is Bill
Bill.
Screen from Air. How are you?
Good.
I was just curious, based upon what you just described, taking that temperature from downstream of the box, and you used the terminology a second ago, boxes in cooling, right?
Yep.
Does that mean they're calling for cooling? I mean, what does that mean?
That means that the supply air temperature coming off of the box would result in cooling of the space.
Okay.
i.e., it's lower. It's lower than the room temperature. Yeah.
But does it say whether or not there's any reheat happening?
So the temperature measurement is after the reheat coil, and
Right.
so regardless whether the box is in is doing a reset or trying to do any reheat at the box, we're measuring the actual temperature being delivered to the room. Does that make sense?
Yeah, no, totally. But is it not true that
yeah, Bill, there is reheat happening even in those cooling hours.
Yeah.
This is called a cooling hour if the room set point is 72 and the supplier temperature is 70 or 71, that's considered a call for cooling because it takes at least 1 degree of cooling in this data.
Yeah.
So, but yeah, to your point, the supplier coming off the air handler is probably 55 and we're doing 18 degrees of reheat at that point, but we're still calling that a cooling load.
Right.
Correct.
Yeah, but we're also calculating these things called BTUs associated with cooling, potentially after heating.
Yeah, it's the net. So essentially, it's the net effect into the space, as opposed to what the air handler might be seeing upstream. So we're not. How should I describe this? There's a net cooling to that space, and we're measuring that value. We're not measuring directly what the air handler is supplying to the box and what reheat is. I mean, we can measure the sort of the valve position, et cetera, but we're not measuring the two pieces independently. Yeah.
But if you total this up and call it tons, then it's potentially understated, right?
Well, I would say it's accurate to what the space is calling for. It's certainly below what the building is providing at that moment.
Mm-hmm.
And I think that's actually to the crux of what we're trying to show is both the value of being able to do, dual temperature or, dual resets, or appropriately sizing the upstream system, because there is a ton of capacity that's happening at the, cooling capacity that's happening at the building level that's being reheated back up. And I think this effort is trying to show, well, what are the rooms actually calling for on a consistent basis over time? And can that help us actually better inform our upstream decisions, either on temperatures that we supplied to the building and or total tonnage at the building level.
Right. But this is a moment in time data selection.
It's a moment in time over an entire year. So for each of these, we have 5-minute increment data for the entire year. In some locations, we also have 2019 and 2020 data, so we're able to compare year to year. But these are looking at full 5-minute increment data for the entire year. And so for the example of patient rooms, we're looking at that patient room, that full sample size for the entire year, and looking for that peak hour over the course of the entire year.
So I had a question, particularly on this chart here for San Leandro. I noticed that the second most demanding room type for cooling seems to be corridors. And did you have any explanation as to why?
Oh, so there's not yet, but there's actually a whole bunch of things that are jumping out to us as strange. And out of what we would expect. And so we're still going through some of the detailed room loads, sort of 5-minute, 5 minutes by 5 minutes to actually search for why some of these zone types might be abnormalities. And I think one of the things that we've done a first pass through is actually looking at how what I would call muddy the zone names are relative to the actual spaces being served. So as you're aware, oftentimes a zone might be tied to, say, an office, and it might pick up a corridor or a chunk of a corridor as well. And so what we've done is started to do a pass through the plans of looking at the zone, exactly which rooms fall into that particular zone, regardless of what it was named, and do sort of percentile comparison about what square footage of that zone is actually made up with that room name versus an ancillary space that might have been tied onto that zone as just part of the design space. So we're trying to get an idea of how much of the data set do we need to filter out because certain rooms might be too commingled, if you will, with multiple room types or zone types. So that's one explanation that sort of jumped out, was that we may have a zone type that is named, X, but it actually is majority Y, and it may be sort of pushing the data in one direction. And then also there's the real possibility of actual sensor error. We haven't calibrated any of the sensors at all. We're just pulling straight from the BMS data, and so we're going to be also looking at some of the room types that loads might be well outside of what might be expected. But we'd love to hear other suggestions of ways that we might want to filter out data.
Yeah, I would offer the suggestion is to only categorize the zone by the space that the thermostat is actually in, because everything else is just indirectly being controlled.
Mm-hmm.
And then I did have a follow-up question to that, because I do run across a number of legacy hospitals where they have zones without reheat coils. And I was wondering if that's a possibility. And perhaps we're subcooling those corridors because they don't have reheat coils. And if we are, that's not truly the load. We should, evaluate what the load is, which is just what the set point is supposed to be in that case. But that's all I had. Thank you.
Yeah, that's a great point. We'll definitely look into that, and especially for some of these spaces that that may not be reheating and subcooling. I would say that one of the biggest things that's actually coming out of the data in general is noticing controls issues. And we briefly mentioned this, I think, in our kickoff call. But one of the things that we had to do, or that we've done right up to this point to help clean that up, is at San Leandro specifically, in the wintertime, the winter months, we're noticing some really highly oscillating room conditions, like in the sub-hour time period of going into deep cooling and then very high temperature heating back and forth because of a controls loop issues, or what we're assuming are controls loop issues. And so there was, in a number of zones, especially in patient rooms, we are seeing what we would call sort of an artificial cooling load that was induced by overheating the space well above set point, like going 5, 6, 10 degrees above room set point, and then going right back into cooling to try to, and then shooting right past room set point and subcooling the space and then reheating it back and forth. For this data set, we went ahead and started and filtered out those months because we didn't have a really clean way of getting numbers that we felt confident in. Essentially between May and I think it was May and October, and Peter, feel free to jump in and correct me, but I think it was between May and October we saw much more steady values that were close to what we would anticipate to see during proper functioning.
Yeah, that's correct. That's exactly what we did. May through October is what we included in the analysis.
Well, if there aren't any more questions on the paper, you guys haven't really had a chance. You just got this yesterday, but we just loved your eyes on it, and any more comments, similar to what you guys have already shared. We'd love to get your feedback on the paper, any areas that you think need more clarity or more explanation. We'd really appreciate that. And I wanted to go ahead and actually share the other file that we sent out to you. Pull it up.
Hey, Stack, while you're opening that, can I ask another quick question?
Absolutely.
So when you calculate the average BTUs per square foot per room, do you do the calculation for each room and then average those afterward?
I believe so. Yeah,
Yeah.
We're looking at each room individually, and we're calculating that for the entire, we're doing that for every hour. Essentially the net load for each hour. And then we're taking those individual rooms and pulling them together. Yeah. I would clarify there's one other thing that we did that didn't result in as much dramatic insight that we thought it might. But because we have 5-minute increment data and we're looking at the net effect per hour, we're essentially summing the hour, like, because as I mentioned, there are rooms that would be in partial, would go into partial heating, then go into some cooling. But we were looking at what's the net effect over that hour. Was it, how many BTUH did we see for that individual hour? One of the things that we were concerned about is by doing that methodology, that if there were some controls issues where 1 hour was quote unquote in heating, even though it was clearly a controls induced heating issue, then the net load that we'd calculate the following hour might be unduly influenced by overheating the previous hour. So we were a little bit concerned about just taking these snapshot in time. And so we also did a running 3-hour average to try to smooth out what might be some of those controls issues. And so we did a comparison of sort of each hour individually versus this running 3-hour average, and it wasn't actually that different. We had a few zones that sort of popped out that helped clean up, but it wasn't as dramatic as we were anticipating. So that was another strategy that we were trying to do to get a better idea of how the data or how the spaces were actually calling for cooling versus what the data might skew because of a controls issue. I'm going to pull up. So we sent this out for everybody. And I don't know if we have to sort of go line item by line item. I think all in all, we had something around 77 comment responses, no more than that, 92. But we've put them in here for all of you guys to be able to see what other folks' concerns might be. But we went ahead and I think today wanted to focus on what we'd call sort of the top priority questions, and then have a because these are just sort of snapshots, but have a chance for you guys to ask, sort of discuss them just as a team. And since from Smith Group's perspective, we have a certain response just on the data side or the processing side, but then a lot of the questions can't talk about intent or where we're trying to go with this. And so obviously both our responses as well as Travis and Kaiser's response is valuable. So if folks want, I can sort of start going through. I think we only had, well, it doesn't really, yeah, these were all high priority ones. But yeah, I'll just sort of move through these. But also, if you have any other sort of comments as we've shared things, feel free to just chime in. But Bill, I think your team came back asking which sensors we were using. So we can certainly share the controls diagram, but effectively the sensors that we're using are the supply air temperature sensor at the tail end of each box. We're using the room thermostat, and then we're also doing the CFM that's being measured at the box. So we have airflow, and we have our delta T between the supply air temperature and the room measured temperature. We also had a few other temperatures that we have access to that we've pulled down, and that includes set point. Because as I mentioned, we didn't use set point in our calculation because the actual room temperature tended to vary in a number of spaces quite far from the actual set point.
Yeah, what I asked a second ago is pretty much what this is about, and you know, is it upstream or downstream of the reheat coil?
Yep.
Was the kind of question to understand, and then you know, where that was going is like right now you have those blocks, and so those blocks are made up of rooms that, you know, they're all in cooling as you described them, but some of them could be in kind of a neutral mode because there's partial reheat going on, because they're, I don't know, maybe they're an interior zone versus an exterior zone, or a opposite exposure versus, you know, one that's getting direct solar gain or something to that effect. And so yeah, to your point about understanding where you're trying to go with it helps to you know, allow us to point our questions accordingly.
Yeah, and I'll let Travis chime in for the sort of ultimate goal, but what we really wanted to do is get a real life sense of, you know, over the course of an entire year, what's the behavior of those spaces? How much variability do we actually see in the call for cooling? You know, the actual cooling load in the space versus, you know, the 55-degree air that we're pumping and then reheating everywhere. You know, because even in VAV systems, you know, there's a considerable amount of reheat, and so, you know, what are the appropriate loads? And then ultimately, like, how does that correspond to the, you know, code minimum CFM that we have to pump through these spaces, and how often do we really need to design anything over code minimum CFM and meet load? And so I think ultimately it's a survey of both anticipated real life loads, which takes into the whole range of diversity of number of occupants that might have been there throughout the year, orientation, you know, solar orientation, you know, room size, et cetera, by trying to normalize all of that and see, well, what do we see across several facilities in real life? Do we see a lot of difference between facilities, et cetera? You know, does it change what we should be doing as design engineers? And does Kaiser want to pull the reins in a little bit on what design engineers are allowed to do for their projects? But Travis, I'll let you jump in for, like, you know, what's the big goal?
Yeah, I think it is exactly that. I would characterize what we found, or I don't know, Bill and I had the chance to talk yesterday a little bit. I would characterize what we found so far is that the peak room loads that we're seeing are kind of not too far off of what I think any of us as engineers doing load calcs would have expected the peak room loads to be, right? Maybe a little lower than you would have expected, but nothing shattering the earth. I think what we're seeing in the data, though, is that anytime you have more than a couple rooms, that the room-to-room diversity that our calculation methodologies would assume to be zero, whether we're doing trace and we put the same load profile into all the patient rooms, or we're doing energy plus and put the same load profile into all the patient rooms. The idea that room-to-room diversity is zero, we're definitely seeing that to be false.
Mm-hmm.
And to the point where I think when Stet and I first looked at them, they look like rather shocking numbers. On patient rooms, right now that number is 30%. When when you have multiple patient rooms, then you should be assuming a room-to-room diversity of essentially 70% of that load sort of walks away on a larger scale. I think, Bill, very much to and somebody else asked a very good question there as well. All of the data that we're looking at here from a data perspective is kind of ideal, because we have all constant volume systems with all reheat zones, right? So everything in this data set is a constant volume zone with a reheat valve. And so that supplier temperature there's always reheat going on. But I think gathering the data at this point and assessing the data at this point kind of puts us in the scenario that we need to be moving forward. As of 2019, OSHPAD has a code that allows us to do VAV, and so Kaiser is going to require, well, from here forward, we're doing VAV. And so I think now we're in a position where we can take advantage of some of these diversities. And that's absolutely what we want to do. I don't know how to do that yet. And I know a lot of questions came in about that. But ultimately, we do want to start having a validation process where we're looking at the equipment that's going in there and validating that against some of these expectations. And all of you on the phone, if you're doing Kaiser work as design engineers, you know that it's tough right now because we are also asking our design engineers to articulate the design of the systems in the neutral condition. If you've been on the phone with us in the last couple of months, we say not only does your BOD need to include the peak load design, but you also need to very clearly describe what are all the CFMs, what are all the GPMs, what are all the valve positions at 9 a.m. in the morning when it's 69 degrees outside. I think that's where we've traditionally failed as an industry, is that we are very, very good at articulating the hottest day of the year. We're very good at articulating the coldest day of the year. But that what we saw in South Bay, about 70% of the year, the weather outside is like 68 to 71 degrees. And so the building is in neutral. And our systems are incapable of turning down. They don't know how. And what we've started to see with our commissioning effort is that unless you very deliberately design systems to be able to turn down, then they can't. And you run into all sorts of problems with that. And so that's where we need to be going with this data, is to design for the profile and not just the peak. I think where that comes in, I expect that the room zone sizing is going to largely stay the same, but the shaft sizing is going to change, and the air handler sizing is going to change, and the turn down of that air handler is going to change, right?
Yeah, and I think one of the conversations that we haven't really taken in the sort of next, which is, as we're looking at these opportunities to sort of downsize, even our own outside air temperature measurements were showing that we were often far exceeding, the design day, even the conservative design day. At least in, especially I think out of all of them, the one that was the most extreme was at San Leandro, which is supposed to be, our marine climate. But if any of you guys are in the Bay Area, you know that we've in the last year had a bunch of heat waves that have exceeded it. And so, what's the relationship between sort of this right sizing of upstream systems while also preparing for, design days that were, far in excess of what ASHRAE might be prescribing? I think the fact that we were oversized at the plant level and in the shafts meant that, a number of these days we rode out those conditions just fine. So I think it's going to be sort of, how do you mediate those two and find the right spot if you're doing a sort of future focused design?
Thank you.
Yeah. So a number of these questions were specific to asking about sort of the data set conditions that we are using. And so we are able to, I will say this. So the energy or the actual data itself, it is going to be made available. I guess we haven't figured out exactly how we're going to share it. The 5-minute increment data, I mean, we have, I don't know, Peter, how many actual data rows we have. It's a huge data set. I mean, we have our own, we sort of built a massive database, but I think the hourly data might be able to be more easily shared versus the 5-minute. But we're still trying to figure out how to make that mobile, if you will.
Even that's a lot. Like, yeah, I think the paper mentions that it summed up, it's like 84, 85 million records, but that's like the hugest, like the widest part of the funnel. And we didn't use nearly all of that. But even the hourly data, I think even just for the cooling, or maybe it's in total, is about 3 or 4 million records. So it's still not small.
Yeah. So we're trying to figure out.
I think let's maybe There's some Mazzetti people on the phone here, and then we'll talk to them later. The other thing about this project in air quotes, is that this is part of that. If you guys have been to those decarbonization of California seminars that have been going on that the California Energy Commission sponsors, ultimately this is part of that. And so my intent, at least, and I need to talk to Mazzetti about how this might happen, is that this be made public. Essentially, the entire data set be made public, and the data methodology being made public through the Energy Commission, mostly to the point of kind of open source software, so that whoever wants to grab it and add to it should be free to do so tomorrow, right?
Yeah, I mean, we'll definitely have to walk through what those challenges are, because yeah, they definitely are some. But I imagine that the actual California Energy Commission might also have an interest in trying to support that effort, especially a number of the questions that came up were about geographic sensitivity or climate zone sensitivity. And I think that's an area where we're still pretty limited, but it'd be really great to get other facilities to be able to add to that set. Next question was just around envelope conditions, different orientations. We are able to sort the data, and we have a couple analysis charts that we'll be able to that we can share. I think we gave a snap preview of those at the last meeting, but we are able to sort by exposure, as well as condition, like envelope conditions we're assuming are pretty steady within the same facility. We haven't gone to the level of looking at like each zone's window to wall ratio, for instance, and seeing how that changes. But by aggregating all of the similar zone types, we should be essentially accounting for some of that diversity. I think we already talked through number 7 and number 8. Yeah, these are all constant volume boxes. We do have, I think, one facility. I don't know if we've loaded it in yet, but that is VAB, or has some VAB in it. Please explain the blue bars. This doesn't appear to be 8760 data. I'm not sure off the top of my head which graph that was pulling. I don't know if Armin or Victor or Eli have a remember what was on page 12 of the presentation, or which the blue bars. My guess is.
Hold on, can you point them?
Yeah, it's in under P cooling room loads. There's a bar chart, and on the y-axis, it's not clear what that data represents. Doesn't appear to be 8760. So just wanted to get a better sense for what that was representing.
Okay, we may have done, so the charts that had sort of the vertical blue bars running from left to right, we had a couple of different things that we were plotting, but doing it by essentially bin hours of how many hours that space was in that load. So I think marching from left to right were bins of load, and then the y-axis were number of hours sitting in that bin. So it kind
how many years of data is that?
I think each of the graphs that you guys saw only represented a single year of data. We do have 2019 data that we have now compared against, because one of the really great questions that came up and in this table or in this peer review were folks asking about, well, what are the COVID implications of taking a 2020 year versus a pre-COVID year? And so we were able to go back to a 2019 and get that full data set. We actually did see a little bit of variation 2019 to 2020, but not, I want to say that like at the patient rooms, it came out to like 100 BTUH, in each zone. So it wasn't a huge, it wasn't a design day change, but we did see some variation. On the interior zones, not so much. But a lot of those don't have a high occupancy count outside of staff to begin with.
Mm-hmm.
Were you able to compare the outside air conditions as well?
That's a great question. I can't remember, Peter, Eli, did we, when we were doing the 2019 to 2020, did we look at the outside air peak condition as well to see if there's too much variation?
We didn't look at that. One of the reasons is that with the it looks like the San Leandro data came online with Clockworks, the BAS platform, in April. So we didn't have a full year of 2019 temperature data, and we didn't. I guess it's one of the reasons we kind of paused that. And we had the 2020. We were looking at that 99.6 value for the entire year, and we didn't have that for 2019. But we could certainly revisit that for just the months of the analysis, May through October.
Yeah, one of the other things that we want to do, because on the outside air temperature that I mentioned in San Leandro was like 97, and the design, ASHRAE design condition is like 83 or 84. Like, it's so far out. We're also going to just double check, because the San Leandro site is pretty close to the Oakland airport. We're going to just do a quick check to see how close we are from a trending standpoint to the local weather station, to see, one, if there might be a calibration issue, or, as you guys know, depending on where you put the weather station on the building, your outside air temperature can be all over the place. And so we just wanted to get a sense of, compare that against a couple other local data sets that shouldn't be too far off, before we make any wild claims about climate change and how our design loads are garbage.
Smart. So because you mentioned that the differences were mainly on the perimeter zone, so that would, it would be good to verify the outside air, the outside conditions.
Yeah,
but
I think the other reason I think those perimeter zones likely see some of that variation is because they're typically the zones that might have more variability in guests. So the patient room, during COVID times, there's a lot more limitation on how many guests you can have in that space. You probably weren't seeing like a whole family, with a patient.
Yeah, that too.
Yeah.
So yeah, net on that one point was that it just, from our perspective, we couldn't see how that rationalized out to 8760, and if it was more than 8760, then which months was it, and so we just weren't understanding how to comment. Yeah,
I think across the board, one of the things that we're trying to do is, on all of our graphs, is one, make the labels larger so they're legible, and that's just sort of a legacy coming out of Power BI, of sort of auto sizing things so they're too small to read, but also just making sure that all the legends are actually legible. That was that's a big thing that we're working on right now. So we talked about the T-stats. So those are sort of standard positions, in the room, and usually on the interior wall, as opposed to the facade. Yeah.
Sure.
Bill, one of your group's comments about, we are obviously, the San Leandro site is one of the old templates. It's the triangular bed tower that I think most of you guys are all familiar with, and the new templates are different. They have higher performance glazing, better wall performance, but they also have a higher window to wall ratio. And so we're like, yep, totally agree with you. And we don't have a data set yet that we've pulled from one of the really recent sets yet, to be able to look at what is that aggregate difference, because it's a bunch of things happening. Your walls are getting better, the glass is getting better, but then you have more glass. And so it's a confounding impact to just say that the envelope is better. We think it generally is. So we think that the delta to the room loads caused by a solar condition or exterior air temperature is likely reduced, but we don't have data to support that yet, or to know to what degree.
Yeah, you've also, all of those buildings have external shading devices. All of those buildings in the patient rooms are active chill beams. There's a whole bunch of things that you'd have to check out. But, one of the other things is ceiling heights. There's a definite, those are all 9 foot, and I don't know that that's the case everywhere. So.
That's a really good point. Yeah, and I think pulling the data from the projects that have chilled beams will be a lot more challenging since we don't have a quote unquote supply air temperature to the space. We have valve position, and we can make a bunch of, or we could get that, but it'd be a lot.
It'd be a little bit more tricky. Yeah,
it's trickier, and there's a lot more error that could be induced into the calculation. Some of the loads are looking just at, especially in the imaging suites, et cetera, like, well, what's going on with the equipment? So since our data set, we're looking at 5-minute increments over the entire year. We don't have operating schedules, so we're just essentially the equipment is operating as it would in quote unquote real life, and we're driving loads. One of the things that's jumped out at us, though, comparing facility to facility, because we are seeing quite a bit more variation in this load from facility to facility, is that we're not accounting for any of these that have, like, for instance, liquid cooled process loads that are pulling load out of the space that we don't know about versus imaging equipment that might be dumping that heat into the volume. And so that's one of the nuances when we start looking at these high internal equipment loaded type spaces, is that we don't currently have a good understanding of how much of the load is being met by the airside system versus what might be being met by the water cooled systems. Yeah.
I mean, unfortunately, eventually you're going to have an opportunity to have richer data than you have right now, right? But my bet is that you pick these different facilities and they're treating different, populations of people, and they don't all have the same issues all of the time. So they're not necessarily having all the same treatment regime all of the time, but there might be commonality in different areas that are served by a particular hospital. So I think that would be really, if you had that data, but you obviously don't have that data right now. Similarly with occupancy, you're looking at all this data, you have no idea if there's anybody in any of these rooms. Right. You don't have the corresponding data set. Kaiser has it because they can track all of everybody's
if the rooms are occupied or not. Yep.
All the devices are. So
yeah, and I think for the GluMac folks, you guys also brought up that similar point, is that we don't have any trend data associated with in the same 5-minute increments about what occupancy is in the room types. In general, I'm pretty sure in general these were all single patient rooms, like single occupant patient rooms. I'd have to go back and double check, but I think the majority of them were. But from an idea of like what's in the space or what equipment, it's sort of per the old template. And so I think how this project may differ from just taking this data set and applying it to a random new hospital that we might all be working on, is that not every system out there has as tight of control over their template or over their facilities that they're building as Kaiser does. And so the fact that we can look across this facility and know that it's very similar to the 4 that were all built within that 8-year period, because the equipment has been templatized, the room footprint, it's all been standardized to sort of the extreme. Whereas other hospital systems that I'm working with, it's the Wild West. I mean, they'd love to have a standard, but they don't. And so I think the caveat that I would put on some of this data is that it's tied very closely to the fact that we have what we would consider in the industry a very consistent template in terms of what equipment might have been in that room. One thing that we want to look at is how does that old template, the old triangular template, compare from an internal load equipment selections to some of these newer facilities? Has the equipment, we have more equipment in some of the newer facilities, has it gotten any more efficient, et cetera? I think that would be a future growth point for the study, is to compare over time which of these facilities, old versus new, how those loads might have changed. That's a really good point.
You can move on to some of the other people's questions, but the one thing I was going to say is that you guys you've come up with this strategy to figure out how to normalize your approach to collecting the data and comparing the data, and that you've kind of gotten past CFM and stuff like that to look at the BTUs. You're trying to get to the other side of that, right? When you if you did look at some of the newer hospitals, you could do a similar thing. You just have to do it differently, right?
Yeah.
Because all your, if you're literally looking downstream of a heating coil, you've got cooling minus heating equals BTUs.
Yep.
Right. And
yeah, exactly.
Which is bizarre, but whatever. But you can do the same thing at all of the new facilities because they've got significantly more robust measurement and verification programs. So you could, take some of the data off the chill water, off the non-condensing chilled water, all of those different systems are metered, and you could do similar blocking analyses.
One of the big things that we've been sort of talking about internally is, to be honest, the data cleaning has not been like the easiest thing in the world. We're pulling out of Clockworks into spreadsheets. The Kaiser team's done a phenomenal job of then, tying the zones to the actual rooms. We've got the floor plans. A lot of that comes out of like that manual work of cleaning the data so that it's usable, could be streamlined in future projects if there was a more robust standard for how BMSs get set up, how zones get labeled. And I'm sure I'm preaching to the choir.
You're definitely preaching to Travis's choir, yeah.
Yeah, but having more consistency and a standard around that actually would make the data acquisition and filtration and taking all these data sets and lumping them together. We're looking at 4 different facilities, all built at different times, different contractors, different control subs, and so there was quite a bit of work to mash all of this together in a robust way that was was honest, and a lot of that was renaming. There's a lot of renaming and appending data sets to each other. And that wasn't
the worst part. The worst part of that was actually there's the BAS data, collecting data from 4 different BAS systems and trying to merge those to one another. The actual most difficult part was the design data.
Yeah.
Right? How our design engineer, because what you need for every zone, you need to know what rooms are in that zone, what's the area of the rooms in that zone, what's the zone that has the thermostat, and across 4 different design engineers, that was the toughest part, right? That's actually the limiting factor when we talked about, hey, should we add another building into this data set? It's like, oh my God, we'd have to go back out and find some Arab plans. Jesus Christ, shoot me.
Yeah, because we all document our work slightly differently, and being able to go back into the actual design drawings and pull out each of those things so that we could do this work. That was actually far more consuming, I think, for Travis's team, like June and everybody. Like they did a ton of front end work so that we could even have data to work with. It was matched.
That's kind of crazy though, because the original template hospital, right? Those should have all been pretty much the same. So I'm kind of surprised that varied so much. The first 4 templates are all done by one organization. So if you'd have picked those 4, then that would have worked out.
But Bill, it gets all the way down to like at San Leandro, we were dealing with in the BAS system, we just have a list of zone numbers, right?
Oh,
yeah.
That's what we have. We just have a list of zone numbers, and then there's temperatures associated with those zone numbers. And it turns out that on that project, the controls installer didn't use the same zone numbers as the design engineer didn't put zone numbers on the plans per se, and so it was a control submittal where the zone numbers actually came in, and so you could look at the record drawings and you just wouldn't find them.
Sure.
And so we had to go back. Ben actually went down to the site, looked at the BAS, got screenshots of every goddamn floor on the BAS, took those back, laid them over the Mazzetti plans, and assigned the zone numbers back to the plans. And then we dug the spreadsheets out of Mazzetti to look at what the calculations were behind all those zone calcs. And that's what we gave the Smith Group.
Yeah. So I'd say that like 3/4 of the work happened before we even had the data, to do our sort of analysis work with. But I think one of the big lessons coming out of this is, there's a ton of information that we can get out of this data. We're just sampling it at looking at loads, but from a database-based commissioning process, this data is amazing. We've already identified controls issues and zones that want us to dive in more. Having a more consistent way, and even an industry or healthcare-wide industry way of documenting or requiring the controls engineer or controls contractor to actually input stuff in would make it a much more easily accessible data. Because I'd say Kaiser's done a tremendous amount of work to dig this all out for us so that we could do the fun part of doing the analytics. And that's really a limiting factor, is their availability to be doing that on site when they also have their actual jobs that they're doing.
Yeah, sure. All right, I'll let you get to GLUMAC.
Yeah. So a lot of GLUMAC, a lot of your questions were fantastic. Looking at, this might be great in California, but different, different states, and obviously Kaiser has facilities outside of California. Oh, we couldn't agree more. We are just taking this data set out from the 4 sites that we have here, and we'd love to have more data. So we'd love to take a super cold climate and look at the variability, as well as high desert or really hot climate. But we don't have access to it yet, so we don't claim that any of our findings directly apply. Although I would say that during peak cooling events, we still think that there's a lot more diversity in the system than we're taking advantage from the design side, even if we are in a more extreme climate. Let's see. So there was a bunch of questions on sort of the quality of the data set, and looking at some of the BTU, the hourly BTU rates go all over the place. So we're doing a ton of investigation into that. As I mentioned, there's a number of zones where when you look at the 5-minute increment data, it's crazy. It's going all over the place. And so some of the information that we'll be giving when we have the data is actually, Kaiser has a commissioning team, I think, in place that's doing work right now at one of the facilities, and we'll be sort of sharing out some of the things that we see that pop out that they might not see as they're doing sort of their walk around, spot checks on site that you really can only get when you start to look at long-term trends. And I would say that's the other big valuable piece that we see with this data set. And really doing any similar work like this, if any of you sort of embark on a project like this with any healthcare systems that you're working with, using these data sets, not just for this analysis, but also being able to look back and find controls issues that wouldn't show up during a typical post-occupancy or retro commissioning process, where you might be just looking at, again, checking control points. You might not see some of the crazy controls behavior that we're able to see in the data, especially when we look at these 5-minute increment sets. It seems difficult to draw a conclusion about south-facing facades on the courtyard. Yeah. Oh, so so we did the analysis of trying to look at different orientations, but it's really hard for us to actually say anything with a conclusion, and that's mainly because of the self-shading, because of the triangular template. A lot of the rooms are actually shaded on those sort of westerly or southern facades. What we did try to do, though, is we did a comparison between those lower floors and upper floors on the same facades to try to see if we saw a significant impact of self-shading. I don't remember Eli, you might remember, because I think you did that analysis. I can't remember if we saw a significant difference between the self-shaded zones versus the upper floor zones from a total load standpoint.
Statistically significant, but not a big enough difference between the two for us to start to worry about it too much. Statistically there was a difference, but when you actually look at the B2H value,
it wasn't like it was going to change a box size, or it wasn't a significant change. But again, I feel
we should have that. We should actually have that conversation here. We talked about there's statistically significant differences that sometimes you see or don't see. Then there's also relevance, which is to say that, if you're talking about 2 BTU per square foot or something like that, then we're not calculating that tightly, right? Our load calc is never calculating that tightly, and so it's not something that you could report it, but it's probably not valuable to do so.
Yeah, and we saw, we've been doing a number of comparisons between sites, between room types, and then between zones within the same, looking for things that are not just significant from a statistical measurement standpoint, but also that might impact design. So we're going to try to be sort of labeling or identifying those differences. But on these particular projects, we didn't see a huge correlation that would impact sizing on the facade, with the exception of the east-northeast zone, which points right at the rising sun, which with GlueMac, you guys also pointed that out. Yeah. So the east-northeast profile was explained by direct sun rising in the morning, but the hours between midnight and 6 a.m. have a significantly lower medians than all the rest of the facade directions. So this may be bad data rather than a climate phenomenon. So that's true. I will caveat all of our data that we're looking at. The big assumption is that the sensors that we're using are relatively accurate. I think when we start to get in the really in the weeds questions, like does this room, how much is it different from another room? I don't think we want to answer that question with this data set, but what we are doing is trying to get a large enough sampling size that we can sort of answer the big questions. I think some of the nuanced, really tiny questions about do we see correlations between this X and Y are, to be honest, are going to be really hard because we haven't done a validation or a calibration of all the sensors, and we're expecting them to be out of spec by a typical install percentage. So it would be great to do a retro commissioning on the project just to sort of get control points. It's sort of outside the scope of what we're doing right now for this particular project, but there is a retro commissioning project happening. I think it's at the San Leandro site in parallel with this, and so we're definitely going to be sharing out some of the things that we find. Some questions on, again, some of the nuanced questions like, are the blinds open or closed? It's hard, I would say we're not trying to draw a particular conclusion about what the impact of that might be, but we're hoping that by having multi-year data sets for each zone type, that we're going to capture various things in various positions, whether it's shades, interior window shades being up or down or closed or tilted, or whether that room had 4 people in it on Tuesday versus not. The idea is that we're looking at sort of, well, what are the real life loads that these spaces are experiencing, regardless of the variability that might be involved, whether it's the facade or occupancy or scheduling, because those same variabilities will likely occur at the new facilities. You'll have ebbs and flows of occupants. You'll have ebbs and flows of scheduling, ebbs and flows of window conditions, or even solar loads. But we're hoping by getting a large enough data set that when you look across the entire data set, we've accommodated for that variability when we're looking at what are these sort of diversified load upstream of the room.
And that's the way that load calcs work now, right?
Correct. Yeah. Yeah, we're not, when we're doing load calcs, for like peak load, for instance, we're assuming, shades are up. And I don't know about all of you guys in your practice, but when we're looking at like block loads, we're not putting in like random schedules for shade rotation. It's, in fact, we do, I'd say, a pretty poor job of, as an industry, of looking at part load conditions or off.
when we all do load calcs now or energy models now, we're very much relying on the law of averages, right?
Yeah.
We're not trying to capture all the nuances on the edge.
Yeah. So it's understood that the goal is to get away from design load calculations and rely on data to better size systems, but due to varying climate, orientations, et cetera, is it possible to meet in the middle? So this is actually a really great question. I think, Travis, you started to talk about it earlier. I think coming out of the data, what we're seeing is actually the room load, the room peak compared to the design peak is not that far off. In some cases, we're hitting it, but it's not that far off. I think the bigger question is going to be how we look at systems upstream. And Travis, you had started to write out, that you guys are probably less interested in prescribing something super precise, but giving a range. And then if the design engineer wants to work outside of that range, needs to be able to justify it. But I don't want to put words in your mouth, but I think that was the general where you guys might be leaning towards.
Yeah, I think that was that idea that I think you see it in that response to number 40 right now. So honestly, we don't know yet how we're going to work with this, but what I very much see happening during design is that we're going to continue to ask design engineers for their load calculations. The peak load calculation of the room is something that I think at this point seems clear to me that the peak load calculation of the room needs to be articulated in some manner that's separate from the peak load calculation for the system. And then we're also very interested in that neutral load calculation of the system so that we can see, what do we think the system is going to do at its top end? What do we think the system is going to do at its bottom end? And we know now, I think, that room-to-room diversity exists at that top end. I think that only helps by bringing that system size down a little bit. That'll sort of help with being able to meet the loads neutrally at the bottom end of the system. And if anyone, well, you guys are all involved in design right now, and so you know that where we're very much going with the design program is for direct validation of your load calcs. Kaiser Permanente vehemently denies that energy models are comparative only. Your energy model is expected to predict the performance and the states of the system that we're going to see, and we load those into our acceptance criteria, and we actually check them during commissioning and then for a year following to make sure that those things actually come true. And so that's where we're going with all this, right?
Yeah.
Has it ever happened?
With the model net?
Well, actually, so on the Kaiser side, stay tuned for January. What's been happening in our commissioning program, just to give you the one-line version of that, is what we've seen so far is that design engineers often are not very good at writing acceptance criteria for the actual performance of the systems. We have a generic set that we've kind of been using and rolling out with most projects. A lot of times, I want to say 2/3 of the times, when we get to the actual commissioning of the system, the acceptance criteria that we imagined during design turn out to be unfeasible, and they need to be changed before we can accept the system. And so coming up this year, we're going to start to implement a change process where, so Bill, you would write the acceptance criteria for San Marcos and so on a 70-degree day, this is how much those pumps are supposed to be running. This is how much those chillers are supposed to be running. This is how much the boilers and air handlers are supposed to be running. And when we get into commissioning and we're at that 70-degree day, if it's radically off, then as the engineer of record, you would need to reissue the acceptance criteria for the system with a reason. This is why it's different from my design. And so that's the process that we're moving towards.
All right.
Yeah, the bar has been set. The next couple of ones are, again, looking at that variability of orientation or some of the elements within the room. I would say, as designs change, expectations on the system side may need to be adapted. I think the key thing though that we're coming away with is that the actual peak room loads that we're calculating aren't that far off. So whether you're looking at different wall orientations or in 43, whether you're looking at some forms of automated shading or more aggressive facade controls, I think at the end of the day, those room loads are still pretty close to what we're actually measured in the field compared to the design loads. So I don't know if there'd be a big change in that. But we'd still challenge to see the team to look at what the diversified loads are. Would this process be applied to new construction or just renovations? Travis says both. I would one of the things that we're seeing from this data set is one, besides the fact that there's a ton of room to improve existing buildings, I think it's also just highlighting the value of having a data set like this as part of a renovations process and being able to use it as both a retro commissioning database-based commissioning process, but also having a much better idea of how existing buildings are performing. I think the big value, and Travis, I'd love to hear your thoughts, but the big value for me when we're looking at these sort of diversified loads is that I think there's a chance, a number of projects that we're working on, not necessarily for Kaiser, but in other systems, are looking at adding more intensive uses within existing facilities that are better revenue generators. Having a data set like this that shows that, the building's never at design peak, and we have a ton of extra capacity there. Means that we may not be having to do as extensive upgrades as we might think when we're doing renovations, and that having existing data would, save us a ton of money on a lot of projects.
Travis had to drop. He sent an apology text, but I think what's going to be tricky about that, and he and I talked about this, is that they're simultaneously seeing that the plants are all running at peaks. Right. So even though you're getting one set of data on the load side, the plants are acting like there are these actual peaks. And so, getting to the bottom of that differential is going to be equally as important.
Yeah. And I think on these older buildings, a huge portion of our load is phantom. When we're looking at sort of the simultaneous peak, your heating, like the reheat going on in these facilities was insane. And when we coupled that with the controls issues where we were having sort of phantomly induced cooling loads based on overheating of spaces and sort of wildly swinging back and forth, I think a lot of that peak plant load can be attributed to that. But I agree. I think it's definitely worth more investigation. We only have a couple more minutes, and this is just the high priority. There's 3 tiers. We ended up scoring these and going through and trying to provide initial responses. We wanted to send this file out, or we sent it out yesterday, because we're hoping that each of your teams can take a look at not just your questions that you submitted, but also the questions of your colleagues at other firms. Look at the initial responses, and then as part of the peer review of the article, if you could send back, even just highlighting the spreadsheet for questions that you think are worthy of a more involved discussion back instead of just a 2-line back and forth. We'd really like to engage in that because again, Travis and the Kaiser team, as well as we're super interested, but Kaiser's really interested in seeing how this evolves and how it impacts us on the design side as sort of design engineers. So we'd encourage you to take a look through the entire response spreadsheet. And like I said, highlight anything that you feel like would be worthy of a more in-depth conversation. With that, I don't have any fancy closing remarks other than thanking you guys for all of your input, because getting these questions changed in a lot of cases the types of analysis that we are doing, but also some of the detailed investigations of comparisons that we hadn't thought about yet. So we want to just say a big thank you for all of you getting your comments in. Did anybody have anything they wanted to say? Robert?
Yes.
Yeah, can you do a quick summarize what is the next steps moving forward? When do you need comment back? on the white paper and
Sure.
the peer review
Yeah.
comment? Yeah.
Yeah, so we need the peer review on the paper. We just submitted the paper to ASHRAE. We'll be getting their comments back, I think, the first week in January. Ideally, we'd like to get your peer review comments on the paper back before you leave for the holidays, so that we have time that first week to collate all the comments together and make any edits that we need. So that would be, I would say, our highest priority. And then the comment response log, again, if you could get comments back to us before you leave, in the next probably 2 weeks would be ideal, in case there's anything that warrants another meeting. And so Travis has a chance to look at that.
Okay, thank you.
Yep. Louisa, did you have a question?
It was the same question. Thank you.
Yeah, no problem. Well, again, thank you all for joining and also providing your feedback. It's been really useful. And if you didn't receive the email from Herb with the 2 files in it that you guys saw today, let us know and we can certainly forward them to you. But otherwise, thank you and have a great evening.
Thanks, you too. Great work.
Thanks, everyone.
If you can send the recorded video out, that would be
Yep.
great.
Yeah, absolutely. We'll try to download that and Herb will get it in a location you guys can access.
Thank you very much.
Yep. Thank you.